Today, we're going to tackle a common, but, often kind of confusing line item on your blood test report, the globulin test. We're going to break down what it is, why your doctor might order it, and what those results could actually mean for your health.
You know that feeling, right? You get your lab report back, and it feels like you're trying to read a whole different language. Well, you are definitely not alone. So let's translate one of those key terms right now.
Okay, let's start at the beginning. I want you to think of globulins as your blood's secret superstars, its unsung heroes. They're working tirelessly behind the scenes, and in this explainer, we're finally giving them the spotlight they deserve.
So what are they exactly? Well, globulins are a really diverse group of proteins. Some of them are made by your liver, and others are made by your immune system. And that dual origin story, that's precisely why they can tell us so much about what's going on in your body.
And believe me, these proteins are busy. They are absolutely essential for fighting off infections. They play a huge role in keeping your liver and kidneys functioning properly, and they even help your blood clot when you get a cut. They are true multitaskers.
Now, to measure these proteins, doctors usually use a couple of different tests. The total protein test gives you the big picture, kinda lumping globulins with another protein called albumin. But if they need a more detailed look, the serum protein electrophoresis test separates them all out. This gives your doctor a much closer look at all the different types and what your immune system is really up to.
So why would a doctor even order this test in the first place? Well, it could be for anything really, from a completely routine checkup to digging into a more specific health concern. First things first, don't be alarmed if you see it on your results. A globulin measurement is often just part of a standard, comprehensive metabolic panel, or a CMP. That's a totally routine blood test to check your metabolism and how your organs are doing, and it's a great way for your doctor to get a baseline for your overall health.
But what if it's not just routine? What kind of symptoms might make your provider look at you and say, let's take a closer look at your protein levels?
Well, if you're experiencing things like jaundice, that's a yellowing of the skin or eyes, or unusual fatigue, swelling, maybe a sudden loss of appetite, these could be signs pointing to liver or kidney issues. A globulin test can provide some really crucial clues to help figure out what's going on.
But it goes beyond just the liver and kidneys. That more specific test we mentioned earlier, the serum protein electrophoresis, that's also a key tool for checking on the health of your immune system.
And this is because specific globulins, especially the gamma globulins, are actually your antibodies. So if those levels are abnormal, it can point towards things like allergies, autoimmune conditions where the body's kind of attacking itself, or even certain types of cancer, like multiple myeloma.
All right, so let's say you need the test. What actually happens? Let's just walk through the process because it's incredibly simple and really nothing to worry about. The procedure itself is just a standard blood draw. It's a quick and simple process where a small sample of blood is taken from a vein in your arm. You might feel a tiny little pinch, but honestly, it's over before you even know it.
And it is so fast. The whole thing is typically done in less than 5 minutes. I mean, think about that. A few minutes of your time can provide this incredibly powerful snapshot of what's happening deep inside your body, from your liver function all the way to your immune response.
Getting ready for it is simple, but it is important. You want to make sure you tell your provider about every single medicine or supplement you're taking. If your test is part of a larger panel, like that CMP we talked about, you might need to fast. But don't worry, your doctor will give you all the specific instructions you need. And in terms of risks, they are so minimal. A little bruising or maybe some soreness where the needle went in is the most common thing you'll see, and that usually fades away super quickly. All right, now for the part I know you've been waiting for. The results are in. Let's talk about what those high or low globulin numbers might actually be pointing to.
But before we get into the details, it is so important to understand this one thing. A lab result is not a diagnosis. It's just a single data point. It's a clue that your doctor uses along with your symptoms, your medical history, and other tests to see the complete picture of your health. So, generally speaking, low globulin levels could be a sign of liver or kidney disease, or maybe even malnutrition. On the flip side, high levels might suggest your body is fighting off an infection, dealing with an inflammatory condition, or it could point to an immune disorder or certain cancers.
And you have to remember, it's not always some big, serious condition. Things as simple as being a little dehydrated or taking certain medications can also affect your numbers. This is exactly why it is so important to talk through the results with your provider.
So, you have the information. What is the most important next step? Well, it's all about having the right conversation with your doctor.
I want you to remember this number, 1. This test is just one piece of information. Your doctor is the person who can put all the different pieces of your health story together.
The main takeaway here is this: use this explainer to become an informed, empowered patient, not to diagnose yourself on the internet. The whole goal is understanding, which will help you have a much better, much more productive conversation with your healthcare team.
So we'll leave you with this final thought. Armed with all this new knowledge, you are ready to have a really meaningful conversation. So think about it. What is the single most important question you can bring to your next appointment to truly understand what your results mean for you?